Hello, my name is Dr. Candace Cabbil, and I'm a mental and emotional wellness coach with Lyra Health. Welcome to Let's Talk About That, the show where every week a Lyra mental health coach like myself answers one of your top questions about mental health and well-being. This week, let's talk about challenging mental health myths in the Black community. How many of you have heard or said therapy is not for Black people? How about this response when a family member or friend suggests that you see someone? For what? I'm not crazy. I'm not depressed. Or I'll just pray about it. And how about this? I can't afford it. I don't know about you, but I have heard many of those statements, and often from my own family members. Very few people feel that they have someone reliable and trustworthy to call within the Black community, resulting in the interplay of limited knowledge, unexpressed pain, stigma, and the lack of access conspiring to keep many families from overcoming unnecessary cycles of hurt. What I have tried to do is model the behavior by seeking professional mental health help, as well as serving my community by becoming a practitioner in the mental health profession. Today, I'd like to discuss in detail the top mental health myths and challenges in the Black community and offer some suggestions on seeking out professional care for yourself. Number 1, what are the unique issues affecting Black mental health? Let's begin by defining psychological fortitude. Dr. Rita Walker, a licensed clinical psychologist, tenured professor at the University of Houston, and researcher who works at the intersection of culture, spirituality, and mental health to address the impact of racial tension on well-being, uses the phrase psychological fortitude to overhaul stigmatized attitudes within the Black community due to the triggering aspect of the word mental as it relates to mental health and visions of being crazy or out of control. She states that some have referred to mental fortitude and mental toughness more broadly as a type of psychological resilience. Resilience that is the ability to withstand, endure, persevere through, and recover from difficult situations. People of African descent in the United States and around the world, individually and collectively, need high psychological fortitude. She goes on to say that Black people need so much more than mental health or well-being in this era of discrimination, invisibility, and psychological warfare. Dr. Walker states psychological fortitude, or PF, is not a one-size-fits-all phenomenon, and that your needs or the needs of your loved one depends on a combination of how much exposure to life stress, discrimination, relationship problems has on your internal mind. If you or someone you care about cannot take on as much as someone else, that does not make you either crazy or weak. You just have to prepare differently and live your life unapologetically for you. One way to check your psychological fortitude is by using a rating system as a quick self-check for how you are doing. Using a 0 to 10 rating scale is easy because you don't have to overthink it. You can do a quick evaluation on yourself or have others share a quick evaluation with you. A 10 rating means you feel phenomenal. Nothing and no one can break your spirit. A 7 rating would pass as okay. You can recover from a stressful situation. You might not be able to cook dinner tonight, but you've had worse days. And know that this too shall pass. A rating of 3 is not okay. You feel completely overwhelmed with life. It's nothing new. This has been going on for years. But if one more thing goes left, someone's going to catch hell. You have no idea how you ended up here and no way to get out. A 0 rating is the lowest possible level of psychological fortitude. Your circumstances are bleak and you have zero desire to go on with life. This rating system is simple and does not have to be perfect, but it works for 2 reasons. 1, it's easy, and 2, it gives you a clear impression of where you are at one moment or on one day relative to another day. Therapy or mental health help is not for Black people. This is our second. One reason for this thought is when many Black people would seek out professional mental health help, they experienced therapists or mental and behavioral health professionals who did not look like them or have shared community experiences. Thus, the conclusion that therapy is not for Black people. Because less than 2% of American Psychological Association members are Black, Some may worry that non-Black mental health care practitioners are not culturally competent enough to treat their specific issues. Culturally speaking, our ancestors had something important that most of us neglect today. They had each other. While previous generations were forced to give up their names, adapt their culture, or die fighting captivity, there was always some connection to the culture. The earliest generations knew that they were African and they survived together under horrific conditions. This mindset of survival was passed on from generation to generation. We were once very clear about who we were and what our collective goal was: survival. And by survival, we understood that individual survival was necessary for the survival of the community. Many of these cultural evolutions provided a buffer that kept us going despite the abominable realities. While the cultural interconnectedness has likely eroded, there is help. It is understandable that Black people have a distrust of the medical community and the mental health community specifically, considering how it has been weaponized against Black people. Finding a mental health practitioner who understands those fears creates a foundation of trust that makes a significant difference in your care. Black mental health professionals don't make you feel like you are fighting stereotypes. They understand the culture which you don't have to stop to explain, and they offer you the freedom to be your authentic self in the session. By recognizing when we need help, we can be proactive in seeking the assistance of professionals who look like us and have shared cultural experiences. If you have difficulty finding a mental health professional who looks like you, seek one with specialized, culturally competent training. Number 3, therapy is only for those who are severely mentally ill. Research suggests that Black people are 20% more likely to experience serious mental health problems such as major depressive disorder and generalized anxiety. Black young adults ages 18 to 25 experience higher rates of mental health problems and lower rates of mental health services compared to white young adults and older Black adults. Historically, there have been difficulty acknowledging psychological issues within the Black community. The go-to coping mechanisms have been coping via religious methods, pastoral care, and prayer. The negative stereotype of instability as well as attitudes of rejection often lead people to believe that mental illness is a personal weakness. Understanding that the Black community exists at the intersections of classism, racism, and health inequity, mental health for Black people is often exacerbated and mostly unavailable. Further compounding the mental health disparities in the Black community are issues related to economic insecurity and the associated experiences of violence and criminal injustice. To reiterate, you are not crazy. What you are experiencing is real. You may be depressed or anxious, but not have the language for what you are feeling. Yes, you can pray about it, as we've seen many benefits religion and spirituality have on your personal psychological fortitude and emotional well-being. And guess what? It is also okay to talk to a mental health professional. Earlier, I introduced a quick and easy assessment tool to gauge your current mental health condition. It is normal to have times when you are feeling unhappy or dissatisfied with your life, especially when you are under stress or during stressful situations such as a job loss, divorce, or death of a family member, and also during a global pandemic. However, if dissatisfaction and unhappiness have been your norm for weeks, months, or years, it might be beneficial for you to speak to a mental health professional. It is important to note that a mental health practitioner plays an important role in your treatment, and it is critical to work and communicate well with this person. The Black community has a long history of social change, and prioritizing mental health is not a sign of weakness, but an act of strength. If you are experiencing or have prolonged experience with anxiety and or depression symptoms which interfere with your work, study, or ability to relate to others, it is a good idea to see your physician or a mental health practitioner. Those experiencing suicidal thoughts or thoughts of harming others should seek immediate medical attention. Number 4, therapy is too expensive. More research is required to understand all the factors associated with the underutilization of mental health care in the Black community. However, one factor is clear. and that is reduced access to adequate insurance and the significant financial burden of treatment among Black individuals. Disparities in access to mental health care have persisted over time. Cost and access must be considered because healthcare costs and prohibitive insurance coverage make it challenging to low-income individuals to access needed treatment. This has a significant impact on the Black community, who have the lowest rates of healthcare insurance of any ethnic group. Here are some tips for accessing free and low-cost mental health care. Check with your employer or insurance provider for free or low-cost mental health services. For example, Lyra Health is a special mental health benefit some companies provide to their employees as their Employee Assistance Program, or EAP, which makes access to mental health care easier and more affordable, even free in many cases. Ask a therapist or mental health practitioner to work with you at a discounted rate or on a sliding scale, which is an agreed fee amount based on your situation or condition. And look online for help such as Mental Health America, MHA, and National Alliance on Mental Illness, NAMI, who offer free mental health resources available year-round. Additionally, NAMI published a list of 13 mental health resources specifically for Black people, so check them out. Jamita M. Barlow, a community health psychologist and assistant professor of writing at George Washington University, states that healing looks different for us than most people, and that Black people have a long history of resilience and creating healing spaces over the last century. While this current global pandemic makes it difficult and impossible beyond digital platforms, Barlow encourages Black people to be in community with one another, socially distancing, of course. Barlow goes on to say that radical self-care is required to live and survive in this world as a Black person. Overdosing on radical self-care is essential in this moment. Finally, here are some recommended tips to help reduce your body's response to stress. Try building a mindful awareness practice. Try breathing exercises to restore calm, a yoga practice, or walk outside and feel the sun on your skin. Create and repeat positive affirmations and write your feelings down. To conclude, life has been unforgiving for Black people in America. Rebecca Ruiz, a New York Times reporter, says that trauma of personal and institutional racism that Black people endure and have endured for generations makes such a statement true no matter the day or the week. I have addressed the top mental health myths and challenges in the Black community, as well as provided information to counter those myths and recommendations on how Black people can empower themselves to address their mental health. I certainly hope you have found the resources provided as insightful and valuable. Thanks for watching, and make sure to tune in next week for another episode of Let's Talk About That. Do you have a mental health related question you think we should cover next? Be sure to let us know through the comment box linked below.